Good morning, my dear students. Welcome to my YouTube channel. Today we will talk about the foramens and the structures passing through each foramen of the skull. In one of the previous videos, we have discussed the foramen of the skull in details, and I had shown you all the foramens. Today I will just discuss about the contents of the foramens of the skull. I will send the link of that video which shows the foramen so that you can see the foramen and then memorize the content, because this is a very important question which is asked always in the Viva. So we'll start with the foramens of the anterior cranial fossa. The first foramen which we had seen in the anterior cranial fossa, rather a foramen, it's a big plate which is called cribriform plate of ethmoid, and from the cribriform plate of the ethmoid passes the rootlets of the olfactory nerve, that is the first cranial nerve. Then you come slightly behind, just at the margin of the anterior cranial fossa, you have the optic canal which passes the optic nerve. Just below the lesser wing of the sphenoid, there is a very large foramen, oblique foramen, which is called a superior orbital fissure. Now this foramen is very important to understand, and this foramen is an oblique foramen. This foramen is divided into three parts by a tendinous ring of Zinn, and that ring will divide this foramen into lateral part, middle part and medial part. And from these three parts of the foramen, you have different contents that are going to pass through it. So from the lateral part, you have LFT, lacrimal nerve, frontal nerve and trochlear nerve. Okay, LFT, remember LFT going from the lateral part. Then from the middle part, you should remember ONA. O meaning oculomotor nerve. You have two divisions of oculomotor nerve, superior and middle. Then you have N for nasociliary nerve, which lies between the two divisions of the oculomotor nerve, and lastly abducent nerve. And in the medial part, you have internal carotid artery and a sympathetic plexus which is surrounding the internal carotid artery. I hope it is clear. So superior orbital fissure, a very important foramen, divided into three parts: lateral part, middle part and medial part. Lateral part LFT, middle part ONA, and in the medial part you will have IS, okay, internal carotid artery and sympathetic plexus surrounding the internal carotid artery. Then you come into the middle cranial fossa. You have to observe 3 or 4 important foramens there. The first foramen, which is foramen rotundum, it's a small foramen there in the anterior part. Through this foramen you have the only one structure passes, that is the maxillary nerve. Then you come to 2 small foramens which are just behind foramen rotundum, that is foramen ovale and foramen spinosum. Foramen ovale has 4 contents: MALE. M for mandibular nerve, A for accessory meningeal artery, L for lesser petrosal nerve, and E for emissary vein connecting the pterygoid cavernous sinus to the pterygoid plexus of veins. Now you should understand the concept of an emissary vein. Emissary vein is a vein which connects the veins which are inside the skull to veins outside the skull. So when you have a content of emissary vein in the foramen, you should talk about its connection. Okay, so that is the foramen ovale. Then you come to foramen spinosum. Foramen spinosum has 3 M's. 3 M's pass through foramen spinosum. The 3 M's are middle meningeal artery, middle meningeal vein and meningeal branch of mandibular nerve. That is foramen spinosum. Then a foramen which is present between the junction of the basi occiput and the petrous part of temporal bone, that is foramen lacerum. Now here this foramen, you should understand that there is the way you speak about this foramen, the contents there is, what is this? The major part of the foramen is filled with cartilage and no significant structure passes through it. So that negation about foramen lacerum is very important, that no significant structure passes through it. But however, through the upper part of the foramen, it is traversed by the internal carotid artery and the venous and the sympathetic plexus surrounding it. Now traversed by meaning the internal carotid artery is going to pass over the foramen. It is not going to go into the foramen. That you have to understand. So foramen lacerum, whenever you are asked, you should start your answer is that during life, major part of the foramen is filled with cartilage and no significant structure passes through it. But you have the internal carotid artery which is going to traverse the foramen and not going to enter the foramen. Okay, so that you should understand about foramen lacerum. So that is about middle cranial fossa. Then you come to the posterior cranial fossa. You have 3 important foramens here. First, there is a foramen in the petrous part of temporal bone which is called internal acoustic meatus. and through the internal acoustic meatus you have 7th and 8th cranial nerve that are going to pass through it. 7th cranial nerve is facial nerve, 8th cranial nerve is vestibulocochlear nerve. Then you come to a big foramen again, which is there behind there, which is called a jugular foramen. The jugular foramen again is divided into anterior part, middle part and posterior part. Through the anterior part you have inferior petrosal sinus. Through the middle part you have 3 cranial nerves, that is 9th, 10th and 11th cranial nerve. And through the posterior part there is passage of the internal jugular vein, okay, and ascending pharyngeal artery. So jugular foramen again, like it is divided into anterior part, middle part and posterior part. Then you come to the largest foramen of the skull. Now please understand this foramen. Here again it has many contents, as good as 11 contents which are there in this foramen. This foramen also is divided into anterior part, anterior narrow part, a wider posterior part and a subarachnoid space. Now through the anterior narrow part you have apical ligament of dens, membrana tectoria and vertical band of cruciate ligament. Now these three things, apical ligament of dens is the process which is present over the second cervical vertebra, that is axis, and that is going to be connecting to the base of the skull. So that is apical ligament of dens. Membrana tectoria again ligaments which are going to be connecting the base of the skull to the axis, and cruciate ligament. These ligaments, basically these three ligaments are going to maintain the atlantoaxial joint, which is a very important joint which is present at the base of the skull, between the joint between the first and the second cervical vertebra. So that is in the anterior part, narrow anterior part. Through the wider posterior part you have lower part of the medulla and 3 meninges that are going to pass through it. And through the subarachnoid space you have vertebral artery, sympathetic plexus around the vertebral artery, anterior spinal artery and posterior spinal arteries. Okay, so these are the contents of foramen magnum. Meaning you have to understand it is divided into anterior part, narrow anterior part, wider posterior part and a subarachnoid space. Then you have 2 foramens which are in front and behind of the occipital condyles. One is called anterior condylar canal, which is also called as hypoglossal canal, and through that hypoglossal canal, it has hypoglossal canal name because the hypoglossal nerve is going to pass through it, and the posterior condylar canal has the posterior ophthalmic artery that is going to pass through it. Okay, so this is about the foramens of the skull and the contents of the foramen. These are the foramens which you are seeing through the interior of the skull. I hope you will like my videos. If you like my videos, it's a request to all of you to please like, share and subscribe my channel. Thank you.